Before we begin today's video, let's practice a bit of mindfulness. Firstly, look at the screen, then slowly close your eyes. And as you do, just leave your mind blank. Then, take in a deep breath through the nose, slowly, then out through the mouth. One more time, in through the nose, and out through the mouth. And one last one. Now slowly open your eyes, and let's begin today's video. In today's video, we're going to be talking about the throat, its anatomy, its illnesses, as well as its illnesses, as we did for most of our past videos. I will name and explain each and every part of the throat anatomy listed on screen. The tongue. The tongue is the fleshy muscular organ in the mouth of a mammal, used for tasting, licking, swallowing, and in humans, articulating speech. Glossus muscle. The genioglossus muscle works in coordination with other muscles of the tongue and throat to perform its function, and its proper functioning is essential for effective speech and swallowing. Another important thing to know about the genioglossus muscle is that there's a left genioglossus muscle and there's a right genioglossus muscle. The mandible. The mandible or lower jawbone is a key part of your skull. Here's a simple breakdown. Location. It is the bone that forms your lower jaw. You can feel it by touching the lower part of your face. Its functions include chewing. It helps you bite and chew food by moving up and down. Talking. It supports your lower teeth and helps shape sounds when you speak. And facial structure. It gives your face its shape and supports the muscles used for facial expressions. In short, the mandible is crucial for eating, speaking, and giving your face its structure. The hyoid bone. The hyoid bone is a small U-shaped bone in your neck. It's located in the front part of your neck, just above your voice box, larynx. You can't feel it directly, but it's situated between your chin and your thyroid cartilage. Its function is to provide a place for muscles of the tongue and throat to attach. This helps with speaking and swallowing. It also helps you keep your airway open by anchoring the muscles that keep your throat and mouth in the right position. The thyroid cartilage. The thyroid cartilage is a part of your voice box, the larynx. It's located in your neck, right in front of your throat. You can feel it as the hard bump on your neck, known as the Adam's apple. Its function is to help protect the vocal cords inside your larynx. It provides structure to the larynx and helps control the pitch and volume of your voice. In short, the thyroid cartilage forms a protective shield around your voice box and helps with making sounds when you talk or sing. The thyroid gland. The thyroid gland is an important organ in your neck. It sits at the base of your neck, just below your Adam's apple. It looks like a butterfly with its wings spread. It produces hormones that help control how your body uses energy. This affects things like how fast your heart beats and how warm you feel. It also helps regulate your growth and development, especially in children. In simple terms, the thyroid gland makes hormones that help your body use energy and keep everything working smoothly. The trachea. The trachea is a crucial part of your respiratory system. It's a tube that runs from your throat, larynx, down to your chest, where it divides into the two main tubes leading to your lungs. You can feel it as a firm tube in your neck. It carries air from your nose and mouth down into your lungs when you breathe in and out. In short, the trachea acts like a major air highway, letting air travel to and from your lungs so you can breathe. The middle turbinate. The middle turbinate is the small curved bone inside your nose. It's located inside your nasal cavity, on the side about halfway up. You can't see it without special tools, but it's one of the structures that helps divide and shape the airflow in your nose. It helps to direct and filter the air you breathe, making sure it's warmed and humidified before it reaches your lungs. It also helps to support the lining of your nasal cavity and can aid in trapping dust and particles. In short, the middle turbinate helps manage and clean the air that you breathe in through your nose. Inferior turbinate. The inferior turbinate is another important structure inside your nose. It's located on the lower side of your nasal cavity, along the wall of your nose, and is the largest of the three turbinates. It's positioned closer to the bottom of your nasal passages. It helps direct the airflow through your nasal passages and warms and humidifies the air you breathe in. It also helps trap dust and other particles to keep your lungs clean. In short, the inferior turbinate helps manage the airflow, making sure the air is properly warmed and clean before reaching your lungs. The superior turbinate. The superior turbinate is a small curved bone inside your nose. It's located at the very top part of your nasal cavity, near the back of your nose. It's higher up compared to the other turbinates, middle and inferior. It helps direct the airflow through the upper part of your nasal passages. It also plays a role in warming and humidifying the air before it reaches your lungs and helps trap more particles. In short, the superior turbinate helps manage airflow and ensures that the air you breathe in is warmed and clean before entering your lungs. The adenoid. The adenoid is a small mass of tissue in your throat. It's located at the back of your nose, just above the throat and behind the soft palate. It's part of the lymphatic system, and it isn't visible without special tools. It helps protect your body from infections by trapping germs that enter through your nose and mouth. It also plays a role in developing your immune system, especially in children. In short, the adenoid keeps helpful germs out of your body and supports your immune system, especially when you're younger. The soft palate. The soft palate is an important part of the mouth and throat. It's located at the back part of the roof of your mouth, behind the hard palates, the bony part you can feel with your tongue. It's a soft, flexible area that extends towards the throat. It moves up to block off the nasal cavity when you swallow, so food and liquids don't go up into your nose. It also helps in the production of certain sounds by changing the shape of the oral cavity and controlling airflow. It separates your mouth from your nasal passages, ensuring that breathing and eating are coordinated properly. In short, the soft palate helps you swallow and speak properly by controlling the airflow and keeping food and liquid out of your nasal passages. The hard palate. The hard palate is a key structure in your mouth. It forms the bony front part of the roof of your mouth. You can feel it by pressing the top of your mouth with your tongue or finger. It extends from the teeth to where the soft palate begins. It creates the hard flat surface that separates the oral cavity in the mouth from the nasal cavity in the nose. It helps you chew and speak by providing a stable surface for your tongue to press against. It also helps keep food and liquid from entering the nasal passages. In short, the hard palate forms the top of your mouth, supports chewing and speaking, and separates your nose from your mouth. The tonsils. The tonsils are important parts of your immune system. They are located at the back of your throat. You have two tonsils, one on each side, and they are visible if you look into your mouth and say ah. Tonsils help trap and destroy germs like bacteria and viruses that enter through your mouth or nose. They play a role in developing your immune system by producing immune cells that help fight off infections. In short, tonsils help protect your body from infections and support your immune system by catching and fighting germs that enter through your mouth and nose. Lingual tonsils. The lingual tonsils are part of your immune system. They are located at the base of your tongue, where the tongue meets the throat on the underside. They help trap and destroy germs that enter through your mouth. They also contribute to your immune response by producing the immune cells that help protect against infections. In short, the lingual tonsils help defend your body against infections by trapping and attacking germs that enter through your mouth. The palatine tonsils. The palatine tonsils are a pair of important lymphoid tissues. They are located on either side of the back of your throat, visible when you open your mouth wide and look in the mirror. They sit in the area between the pillars of your throat, the tonsillar foci. They help trap and destroy germs, bacteria and viruses that enter through your mouth and throat. They play a role in your immune system by producing immune cells and antibodies to help fight infections. In short, the palatine tonsils are located at the back of your throat and help protect your body from infections by trapping and attacking germs. Just to be clear, the reason I'm not going to talk about the pharyngeal tonsil is because the pharyngeal tonsil is another name for the adenoid, and I already talked about the adenoid. So if I talk about the pharyngeal tonsil again, I'll be repeating myself when I already described the adenoid, and the adenoid and the pharyngeal tonsil are the same thing. The epiglottis. The epiglottis is a crucial part of your throat. It's a flap of cartilage located at the base of your tongue, just above the larynx, the voice box. It sits behind your throat and is visible when looking down your throat. It acts like a little flap that closes over your windpipe, the trachea, when you swallow. This prevents foods and liquids from entering your airway and going into your lungs. When you're not swallowing, it opens to allow air to pass through the trachea to your lungs. In short, the epiglottis helps ensure the food and liquids go down your esophagus and not into your windpipe, keeping your airway clear for breathing. The vocal cords. The vocal cords, also known as vocal folds, are essential for producing sound. They are located inside the larynx, voice box, in your throat. The vocal cords are positioned horizontally across the larynx, just above the trachea. When you speak or sing, air from your lungs passes through the vocal cords, causing them to vibrate. This vibration produces sound. The tension and length of the vocal cords can be adjusted to change the pitch and volume of your voice. In short, the vocal cords are found in the larynx and are responsible for making sound when you talk or sing by vibrating as air passes through them. The esophagus. The esophagus is a key part of your digestive system. It's a muscular tube that runs from your throat, the pharynx, down to your neck and chest to your stomach. It sits behind your trachea, the windpipe, and heart. Its main job is to transport food and liquids from your mouth to your stomach. It uses a series of muscular contractions called peristalsis to push food and drink down to your stomach. In short, the esophagus is located in your chest and neck and functions as a conduit to move food and liquids from your mouth to your stomach. As you've probably noticed in this chapter's title, we're going to be talking about common throat illnesses. Postnasal drip. Excess mucus from the sinuses dropping down to the throat, often due to allergies or sinus infections, can cause throat irritation, cough, and soreness. Whooping cough or pertussis. Whooping cough is a highly contagious bacterial disease that causes severe coughing fits and can lead to throat irritation and discomfort. Sore throat. A sore throat is pain, scratchiness, or irritation in the throat, often making it uncomfortable to swallow or speak. It can be caused by various factors, including infections, viral or bacterial, allergies, dry air, or irritants. Tonsillitis. Tonsillitis is an inflammation of the tonsils, which can be viral or bacterial. Symptoms include a severe sore throat, difficulty swallowing, and swollen tonsils. Streptococcal bacteria can cause bacterial tonsillitis. Strep throat. Strep throat is a bacterial infection caused by group A Streptococcus bacteria. Symptoms include a severe sore throat, fever, headache, and swollen lymph nodes. Pharyngitis. Pharyngitis is the inflammation of the pharynx, often caused by viral infections like the common cold or flu. Symptoms include sore throat, scratchiness, and sometimes fever. Laryngitis. Laryngitis is the inflammation of the larynx, the voice box, often due to overuse of the voice, viral infections, or irritants. Symptoms include hoarseness or loss of voice, throat discomfort, and a dry cough. Like with most of our videos, if not all of our videos, we've talked about rare illnesses regarding that part of the body we talked about during the video. So, for the throat today, we're going to talk about rare illnesses for the throat. Wegener's granulomatosis, otherwise called granulomatosis with polyangiitis. This is a rare autoimmune condition that causes inflammation of the blood vessels, including those in the throat, leading to symptoms like sore throat, nasal congestion, and hoarseness. Behçet's disease. Behçet's disease is a rare autoimmune disorder that can cause recurrent mouth and throat ulcers, among other systemic symptoms. Kawasaki disease. Though more common in children, this rare condition can cause inflammation in the throat, along with other symptoms like fever, rash, sore and swollen lymph nodes. Diphtheria. Diphtheria, once a common throat infection caused by bacterium, Corynebacterium diphtheria, is now very rare in places with high vaccination rates. It causes a thick coating in the throat that can lead to breathing problems. fungal infections like histoplasmosis or candidiasis. While fungal infections in the throat are rare, they can occur especially in immunocompromised individuals. They cause symptoms like sore throat and difficulty swallowing. Mucormycosis. This is a rare but serious fungal infection that can infect the throat, often seen in people with weakened immune systems or uncontrolled diabetes. Amyloidosis. This rare condition involves the buildup of abnormal proteins called amyloid in various organs, including the throat, potentially causing swelling and other symptoms. Primary immunodeficiency diseases. Some very rare genetic disorders affecting the immune system can lead to chronic throat infections or other throat related issues. These conditions are rare and often require specialized medical evaluation and treatment. If you have symptoms that are unusual or persistent, consulting with a healthcare professional is essential for an accurate diagnosis and appropriate management. We have now reached the end of today's video, and with that, I would like to leave with a few parting words. So first of all, I hope you gained some knowledge about the throat after watching this video, and a big thank you for if you made it this far into the video. And if you made it this far, you might as well just hit the like and subscribe buttons because it really helps me out a lot. And thank you for watching. Have a great day, everybody.